What's hiding underneath things can be scary. Underwater, under your bed, especially what's under your carpet. Except when you get new carpet from Carpet One Floor and Home. After tearing up your old carpet, they'll vacuum and apply Health Annex antimicrobial to your subfloor, disinfecting and killing mold, mildew, and any remaining general awfulness. Carpet One Floor and Home goes the extra mile to protect you, your family, and your home. Carpet One Floor and Home in Columbia, making your home beautiful, guaranteed.
Good morning and welcome to Radio Friends on Tuesday, April the 5th. We're going to pick up a topic that I think we covered, it was a couple of months ago, sleep apnea. And we have Dr. Jeremy Johnson with us from the Harry S. Truman Memorial Veterans Hospital. Good to have you back here.
Thank you,
Doctor.
Paul. Thank you.
How many people in our country are affected by sleep apnea?
Yeah, that's a great question. There's lots of people that have obstructive sleep apnea. And some of the early studies back in the early 2000s demonstrated probably 9 to 18% of the general population has obstructive sleep apnea. And you know, as the population ages and becomes more overweight, then those are things that are big risk factors for OSA. And so it's quite common.
So what exactly is sleep apnea?
Yeah, we touched a little bit about that during the first session that we had. It's obstruction of the upper airway or collapse of the upper airway while we sleep. And so then airflow doesn't move from our mouth or nose to our lungs as normal when we're awake. And so then that can cause oxygen problems. It can cause arousals from sleep. And so it can have lots of deleterious effects on our health. It can lead to problems with high blood pressure. It can be a risk factor for stroke, heart failure.
Sleep apnea?
Yeah, sleep apnea. So we know that if people have moderate or severe sleep apnea, it has to be treated because there's lots of effects on our general health if we don't treat sleep apnea.
Okay. How do you know if you have sleep apnea or not?
Yeah, so we talked about some of the warning signs being snoring or loud snoring.
Just because you snore doesn't mean you have sleep apnea.
Correct. It doesn't mean you have sleep apnea, but you need to be studied probably to see if you have obstructive sleep apnea. And so there's other warning signs like stopping breathing during sleep, and if somebody witnesses that, or you notice yourself arousing from sleep, choking or gasping, those are kind of warning signs. And then you have to get a sleep study to diagnose sleep apnea.
Okay, so how is it treated? You got some novel ways that it's treated.
So we talked last time about the gold standard being CPAP, or continuous positive airway pressure, a pressure that's applied through a mask just to splint the airway open. We talked last time that not everybody tolerates CPAP. I've heard people say, I'm not even going to have a sleep study because I'm not going to try that mask. But what we have to have, for sure our veterans know and the general population know, that there are many alternative therapies to treatment of obstructive sleep apnea. There's more out there than just CPAP. So if we talk about, one thing, maybe an oral appliance or a mouthpiece that you wear during sleep, all the alternative therapies are aimed at stabilizing the airway and opening the passage. So
a mouthpiece.
Yeah, so an oral appliance or what's called a Mandibular Advancement device. It's usually made by a dentist, and it's fitted for the individual patient, and it helps bring the lower jaw forward just a little bit and help stabilize the muscles of the airway. And so that may be an alternative therapy.
To the CPAP?
Yeah, to CPAP, yeah, right. Some folks with mild or moderate obstructive sleep apnea may be completely treated with just an oral appliance. We usually try CPAP first, but we know not everybody adheres or is compliant with CPAP. So that's one. There's upper airway surgeries that can be done to address the obstruction in the upper airway, and so there's surgical therapies. Then there's these new novel things like hypoglossal nerve stimulation or a neuromuscular stimulator that may be used during the day for treatment of obstructive sleep apnea.
Explain that.
Yeah. So hypoglossal nerve stimulator is a novel device. It's like a pacemaker, if you will. You have a generator implanted underneath the skin in a pocket. It has a sensing lead that goes somewhere between the rib cage and the muscles of the ribs. It senses breathing.
So wait. So you're implanting this like a pacemaker.
Yeah.
And then there's a little wire that is sent down under your skin.
Yep. To the breathing muscles that are in outside the rib cage, and so that senses breathing. And then there's another lead that goes to the hypoglossal nerve, which is the nerve that innervates our tongue and helps control movement of tongue. And so,
is this a major surgery that you're doing?
It's not a major surgery.
It sounds like
I don't perform the surgery. It's usually done by head and neck surgeon or an ear, nose, and throat surgeon, an otolaryngologist. And so it's usually a fairly simple outpatient surgery that the device is implanted.
You're putting in the thing like a pacemaker, running a wire to your ribs and another one to your tongue?
Yeah, to the nerve that innervates the tongue.
Okay.
And so then you turn it on with a remote control at night. And then it senses your breathing.
Kind of like Darth Vader there.
Yeah, we're becoming bionic.
So you've got a remote control that turns it on.
So it's a device, it's a controller that turns it on, and then it senses breathing while you're sleeping, and then it controls the device that's innervated to the nerve that controls the tongue, helps control tongue movements to optimize or maximize the air passage while you breathe in coordination to help keep the upper airway open or patent so that you don't have obstructive sleep apnea.
That is amazing.
Yeah.
Well, now, could somebody opt to do that instead of even trying the CPAP?
Yeah, so this novel treatment is aimed or saved for people with moderate to severe obstructive sleep apnea. And there's other things that you have to have to be a good candidate for it. So if you're the right candidate, usually, in most circumstances, CPAP is, again, we talked about last time, the definitive or the best therapy. So usually somebody has to try CPAP and fail CPAP, although there's some folks that say, I'm never going to do that. And so we'd rather treat you than not treat you. So maybe some in an isolated instance.
So if somebody came into you today or after hearing this segment and said, I don't want my CPAP anymore. I want that what'd you call it?
Nerve stimulator, a hypoglossal nerve stimulator
that I can control with remote control.
Yeah. So we'd go through things, the checklist, to see if they're a decent candidate for this procedure. And then if they meet the criteria to be a candidate, then a sleep physician would be seeing them and usually would refer them to an otolaryngologist or a head and neck surgeon that implants that device.
And the batteries in that unit, do you have to go in and change those batteries from time to time?
Maybe. Of course, we know like in cardiac pacemakers that maybe the battery has to be changed every 15 years. Of course, that's used around the clock, a pacemaker. Yeah. So this is used at night when you sleep. So maybe
you don't plug your battery in to charge it up.
No, there's not a way to charge it, but maybe the battery would have to be changed down the road. But that would be many, many years down the road. Yeah.
That is amazing. That is absolutely, you piqued my interest on that. Hopefully I don't have sleep apnea or we'll never need it, but I would sure opt for that instead of wearing the CPAP.
Yeah, and that's what we find. Not everybody wants CPAP therapy, and so we have to have alternatives so that patients don't have bad outcomes from their sleep apnea. It can cause severe sleepiness, so car accidents, work accidents. It can cause all sorts of heart and blood pressure and diabetes problems, and so we have to treat it. So if you can't tolerate CPAP, what are alternative therapies that we can offer?
For more information, how do they contact you?
Yeah, so I think when you're looking at alternative therapies, you're going to be seeing a sleep physician. So you probably need your primary care physician to refer you to a sleep physician. At the VA, our veterans can contact the pulmonary and sleep section directly through 814-6000, extension 53363.
All right, Dr. Jeremy Johnson, thank you so much for coming by.
Thank you, Paul.